malaria. So I thought, where can I get funds? I can't sit around and just don't do anything. So I decided to write to Rotarians Against Malaria, and they told me they couldn't give grants at that time. So they referred me to Malaria Partners International. So when I started, I was the only representative of malaria. So I decided to set malaria committees in each of the 10 West African countries. As you see, this is Rotary District 9101. We're in 10 West African countries. So I decided to set up a malaria committee in each of the countries so that they can easily be able to carry out malaria prevention programs. So a first grant that we received, since I'm from Gambia, so we started in Gambia. So we received a $5,000 grant from Malaria Partners International. And that's how we started in Gambia. We did a malaria walk. We started with different projects, which I will show you in the next slides coming up. And from there, I talked to Malaria Partners International that I'm not only chairman of Malaria Committee in Gambia, but also head of malaria for these 10 West African countries. I would like for all of them to have money, grants to be able to carry out malaria prevention program in their countries. So we signed an MOU, which they agreed to offer a $5,000 grant to each of these malaria committees in each of these countries after submitting a proposal, which they would agree upon, and then we'll carry out the project. Next slide, please. So my first policy was we always have to work with the National Malaria Control Program. Even though as Rotarians we can't do, since malaria is under health, we can't do a solo work. We have to work with National Malaria Control Program. So I encourage each of the National Malaria Control Program, each of the Rotary Malaria committees to join hands with the National Malaria Control Program. So as you can see, this is one malaria day. So after we received the $5,000 grant, some of the countries did. You can see in Burkina Faso is there, and we participated in that too. In Guinea, they had a seminar, the Rotary Malaria Committee had a seminar where they invited the National Malaria Control Program and members of the public. Next slide, please. And some of the different ways that we can do malaria prevention program in West Africa. In the Gambia, I started a radio program where, as you can see, there's a health communicator from the Minister of Health. We hired them so that they can do panel discussions on malaria prevention to teach the public about malaria prevention, because we realized that the government is doing the big scale preventions like providing bed nets and indoor residual spraying, but then the community did not using them effectively. So we felt it necessary to do programs, radio programs, to educate them about how to use the bed nets, the importance of it, and other malaria prevention messages. In Liberia, you can see these were billboards. The first picture is a billboard that was two billboards that were set up, and the far right is a sticker that was made to put in the back of cars and everything. And we also use newspaper, and this is in Gambia, where all our programs, we invite the media and they see what Rotary is doing. So we can see a newspaper report on Rotarians Embark on Malaria Prevention Control Campaign. And then also in the Gambia, we have TV programs that we go on live TV programs and talk about malaria prevention. So these are some of the advocacy we do. Next slide, please. And then we have, during bed net distribution, we have the national bed net distribution. We also joined we joined the National Malaria Control Program to distribute bed nets, as you can see in the different sites we have. And then in Mali, their project was providing bed nets for a refugee camp, and also the RDT, which is the test kits. And we always have the support of DG, which is DG Sonny, who, as you can see in the picture behind, at the back. So thank you, DG, for always supporting us. We also had the support of PDG, Christopher Foster from Sierra Leone as well. And this is in Gambia also advocacy for pregnant women and mothers, children under 5 years old. We go to different hospitals and health centers where we, on clinic, antenatal clinic days and pediatric outpatient days and teach the mothers of children under 5 years old and the pregnant woman the importance of malaria prevention. And then we also have the nurses coming and also give their own educational aspect of it as well. As you can see in Gambia, we did several projects on that in different hospitals, about 6 hospitals we did. And then in Sierra Leone. And our biggest achievement was at the 6th District Assembly Conference we had in Gambia in 2019, where we had a malaria march on the busiest highway. Then we had the privilege of having the First Lady of the Gambia and also the Vice President joined us. As you can see, the woman raising her hand is the First Lady of the Republic of Gambia, and the woman next to me is the Vice President. So this was a big achievement in our country, in the Gambia, where we had the ministers, the government participate with us equally. And then we also had community outreach program in the Gambia where we went to the rural areas and talked to the community leaders. And this was the last one at the bottom also is at the market, where we took our banners in a popular market and spread the malaria prevention message throughout the rural areas where malaria becomes endemic always. Thank you very much.
Good morning, my dear friends.